Hi everyone, today I want to talk about a topic that is very close to my heart, mothers. Mothers who have been through a beautiful journey with their bodies, delivering their babies, feeding them, caring for them, also caring for the families, their husbands, and not forgetting their bodies. We've followed a diet plan, we've exercised, we've lost all that weight that we've gained, but still when we look into the mirror, we don't recognize this body. This is not vanity. This is us wanting to feel comfortable, wanting that confidence back and that right proportion for our body so that we can just fit back into our clothes. So today, my friends, I want to discuss certain body contouring procedures that can help us regain that comfort and confidence back. Now, pregnancy and massive weight loss changes our bodies in very specific ways. There is that loose hanging abdominal skin, especially in the lower abdomen, with a lot of stretch marks, and this occurs because the skin has been stretched beyond its certain limit and refuses to retract back to its original position. Then we have the fat redistribution that has occurred, and there's stubborn pockets of fat usually seen in the flanks, lower abdomen and the thighs. Sometimes we also see a separation of the core muscles, that is your central abdominal muscles, and this is also called as diastasis recti or DR for the short form. This may be accompanied by a herniation of the central abdominal contents like your stomach or intestines if the separation has been massive. Why does this occur? Because of drifting a part of your muscle to make space for the baby or the fat deposits. And finally, we have the breast that have lost volume and continue to sag post breastfeeding and pregnancy. Now, exercises help us remain healthy and makes us stronger, but even then they have their limitations and they cannot get rid of that excess skin or that fat, stubborn pocket of fat, or nor can it repair that muscle that has been separated. So that is why I have very fit young individuals coming to me and telling me that no matter how hard they've tried, these issues refuse to go away. So what are the body contouring procedures that can help such a person? We have liposuction, which is a body contouring technique where the fat, the stubborn localized pockets of fat is sucked out to give you a nice contour or shape that is suitable for your body frame. But liposuction alone cannot get rid of that loose abdominal skin, nor can it repair that separated muscle. So for these issues, we have a procedure called a tummy tuck, where we go through your lower abdomen, a small incision in the bikini line, or if you've had a previous C-section scar or a cesarean section scar, we go through that scar and we repair the muscles that have been separated, we repair the hernia if it has occurred, we reposition your umbilicus back to its original position and get rid of that excess stretched out, loose, sagging skin in the lower abdomen. So this procedure helps you regain your core strength back, helps you improve your posture and gives you a nice shapely abdomen. And finally, for the breast, we have a procedure called a breast lift, but sometimes some people may require this lift along with some form of an augmentation with an implant or fat transfer. Now, who is an ideal candidate for these procedures? I personally want my patients to have a stable body weight for at least 6 months, to not have any immediate future plans of pregnancy, and they have to follow a good healthy lifestyle and follow a diet and exercise plan post procedure. Remember, there is no single best procedure. Every body is different. Everyone needs a customized body contouring plan. We need to have an open discussion with your plastic surgeon and understand what is suitable for your body frame and your body type. And always know that these surgeries have to be performed safely in a hospital with a surgical ICU setting. So if you are considering a body contouring procedure, please get in touch with us, have a detailed consultation and know what works best for you. Thank you.